Minister Byrne, this week we heard that the Merchants Quay project were refused planning permission for their medically supervised drug injection facility, and we just wanted to see what your reaction to that was.
Well, I was very disappointed, to be honest with you. We need this service. There's people dying in our city on the streets. There's people overdosing on our streets. There's huge evidence across the world in all of the services that supervised injection medical service, if it's in place, saves lives. Nobody has died in any of them, which I think is so important. I think so far last year there was 35 deaths in Dublin around injecting. And I really think that we need a service like this to draw in those people who are very vulnerable. A lot of them homeless, a lot of them struggling with their addiction and finding themselves up laneways and around the area injecting openly is devastating for them, but it's devastating for the public as well. I do believe that Merchants Quay will go forward to on board Penala with an appeal, hopefully, and I'll do anything I can to support that appeal for them. I really think it's important, as the capital city of this country, we need to take what's happening on our streets very seriously, particularly when people are dying, when they can be helped in these services. And not only is it a medically supervised injection facility, it's there will be medical teams there to advise people and to bring them on to other services, and I believe that's why I'm so disappointed that Dublin City Council didn't see the actual bigger picture of how this would help not only the person in addiction but the community as well, because a lot of the concerns around Merchants Quay were about the vulnerability of people stepping over needles, and young children as well picking them up, and people openly injecting, and that takes that off the street, and the research is there across the world that it does work.
Because what we saw this morning was the litter on the streets. What's left behind? We have a situation where the addicts are going to Merchants Quay in the morning. They're picking up clean needles. They're picking up all the facilities they need in order to take their drugs safely. Naturally, then they now have to go off into laneways, back alleys where they're not seen, and then Merchants Quay are having to go out and tidy up the stuff that's left behind, all the cooking pots, the vials of water, the needles, and bring them and dispose of them safely. Whereas obviously, if they could inject in a centre, that would be eliminated.
Medically supervised, and that if they do get into trouble when they are taken wherever they're injecting, it means they can be helped and responded to quickly on premises if they have an overdose. And I think that's, for me, it's saving lives. That's what the service is about. But it's also helping the community to understand that these people are very vulnerable. They're on the street every day of the week. Can we leave them out in the open doing what they're doing? Because if we continue to do that, more people will die. I know there's huge concerns locally around just the service and the amount of people attending. That will be well supervised and responded to by the guards as well when planning permission goes through, and if on board Penala, if the appeal goes through on board Penala and it's passed. Everything will be done in that community to help quench the fears and the concerns of people locally.
So we're not giving up on medically supervised injection centres?
We certainly aren't. And this is a pilot project. I mean, this just 18 months, it's a pilot project. If this works and it works well, there's other opportunities to go around the country with services like this, which is needed. Dublin isn't the only place where people are injecting. It's right across the country. But I do think we're looking after the most vulnerable, and we need to treat them as human beings.